Okay, you old folks, listen here. I got one thing to say. Sex. Sex. Sex.
Sounds fun.
Sex. What? One more time. Sex. Old people.
Hey, 80 is the new 60. That means we're more vibrant, more interested in other things that people of our age years ago might not have been interested in, such as sex.
They ask absolutely everything. And they'll ask about anal sex, and they'll ask about any behavior.
When I told my granddaughter that I was taking this lecture, she said, "I don't want to hear about it, Grandma."
And it's our discomfort of thinking that old person couldn't be having sex. Like dirty old men, we think of it old men, that young men aren't dirty, they're just sexually active, and right? I mean, it's like sex only belongs to youth for some reason.
It is just so clear. Single older women as a demographic are about as fucked a group as can ever exist.
No, we're not 25 anymore.
Well, you're not dead either. Lots of couples our age lack intimacy in their marriages.
I didn't say we weren't intimate. There are special occasions, anniversaries, and on our anniversary.
You can tell by the shape of the box what it is, I think. And it's not a vase for flowers. And it's very nice. And it's just about the size of my last lover. We measured. Because of course we love men, and we want to be in bed with men.
I still enjoy hearing about sex and all that.
To this day, I have a very romantic husband, kissing me, fondling me, constantly not leaving me alone, and it's a wonderful feeling.
Don't look at me.
I really would like to hear the sexual dysfunction part of the lecture.
So, hi, my name is Sopak San. Right now I'm going to talk about female sexual dysfunction in the elderly. Female sexual dysfunction include painful intercourse and lack of sexual desire. Painful intercourse includes vaginal dryness, injury, trauma, or irritation, inflammation, infection, or skin disorder. Vaginal dryness is a common problem for women during and after menopause. As you age, the amount and consistency of moisture that coats your vaginal wall decreases. Vaginal dryness is a common problem for women during and after menopause. Reduced estrogen level are the main cause of vaginal dryness. Estrogen, a female hormone, helps keep vaginal tissue healthy by maintaining normal vaginal lubrication. Allergy or cold medication as well as some antidepressant can decrease the moisture in many parts of your body, including your vagina.
Kids, it don't get any easier.
Treatments and drugs for vaginal dryness include vaginal estrogen therapy, vaginal estrogen cream or a ring or a tablet. You can also use lubricants or moisturizers. Another female sexual dysfunction include the lack of sexual desire. Women skip sex for many reasons that have nothing to do with desire, including fatigue, stress, poor body image, or lack of emotional intimacy. A glass of wine may put you in a better mood, but too much alcohol can spoil your sex drive.
Though I'm happy to report that no such calamity has ever befallen yours truly. Oh, yes.
Treatment for low sex drive. There are lifestyle changes. Healthy lifestyle changes can make a big difference in your desire for sex. Other treatments are relationship changes. It could be communication with your partner, talking about your likes and dislikes can set the stage for a greater sexual intimacy. Seek counseling, set aside for time for intimacy, or add a little spice to your sex life. But remember, your sex satisfaction is a vital part of your overall health and well-being.
That sexual activity adds spice. I really feel it keeps me more alive, more vital.
If life is a Cajun gumbo, then sex is that cayenne pepper kick in the ass that everybody's looking for.
If you don't know my name by now, shame on you. But I'm here to talk to you about sexual dysfunction. That's what I'm here to tell you about. I'm a male, but I don't have any sexual dysfunctions. too young. The normal sexual response in a male involves erection, emission, and ejaculation. 90% of sexual dysfunction cases involve organic factors, like vascular, endocrine, and neurologic disorders, chronic diseases like renal failure or diabetes, penile diseases and penile trauma, and finally iatrogenic factors like surgery and pharmacological therapies. The effects of aging on sexual function include you need more stimulation to become erect, the force of your ejaculation is decreased, your ability to attain erection is decreased, it's a little harder to get one, the size and rigidity of the penis at full erection is decreased, and you have a decreased libido and interest in sex. Erectile dysfunction is the inability to attain or maintain an erect penis. It affects 20 to 30 million men in the U.S. The effects of ED potentially interfere with a man's self-esteem, his confidence, it hurts his relationships, and overall sense of well-being, especially with his concept of himself as a man. Some secondary causes of sexual dysfunctions, or erectile dysfunction specifically, and are related to low energy levels, stress, or depression, which causes the psychologic erectile dysfunction. Commonly used drugs that affect sexual functioning especially are alcohol or other CNS depressants, antihypertensives, antidepressants, antihistamines, drugs for prostate issues, and hormonal preparations. Drugs for treatment of erectile dysfunction, or ED, are Viagra, Cialis, and Levitra. They cause smooth muscle relaxation and increase blood flow into the corpus cavernosum, which gives you erection. You're supposed to take them about an hour before sexual activity, because we all plan it, but no more than once a day. If you're on nitro, it's totally contraindicated because it can potentiate hypotensive effects. And then there's the vacuum constriction device, which I don't know if you've seen Austin Powers. It's kind of similar to the Swedish-made penis enlarger.
I'm telling you, baby, that's not mine.
It's placed on the flaccid penis and produces an erection by pulling blood up into the corporeal bodies. And then a band is placed at the base to maintain blood in the area. Once you're done, you just take it off and blood drains. Hopefully. Then you have your intraurethral medication pellet, and you use your medicated urethral system, or your MUSE, for injection, and teaching specific on how to do this very carefully. You inject alprostadil, or Caverject, it's a little pellet, into the urethra. It increases blood flow to arteries. Next you have your intercavernosal self-injection. Use your imagination. Now you have your penile implants. They're usually indicated for men with severe erectile dysfunction for which other interventions are ineffective. It's a surgical procedure and they implant a semi-rigid or inflatable penile prosthesis into the corporeal bodies to provide an erection. You got your malleable. It's always erect, but can be bent close to the body to be hidden. Then you have your inflatable, which consists of cylinders in the penis, a small pump in the scrotum, and a reservoir, in the lower abdomen. When activated, the pump fills the cylinders with fluid from the reservoir. A small release valve permits the fluid to drain back into the reservoir after intercourse. Just like that.